Hey everyone, this is Holly Knudsen. I'm a functional health practitioner from Utah, and today I'd like to continue my cancer series and talk about the symptoms of pancreatic cancer you should not ignore. The pancreas is a pear-shaped gland, and it's about 6 inches in length and is located at the bottom of the breastbone right behind the stomach. Pancreatic cancer is an aggressive cancer that is notoriously difficult to diagnose and treat, and it's rarely detected in the early stages, with symptoms becoming apparent only after the disease has progressed. Here are some facts about the pancreas. It's composed of 3 sections, the head, body, and tail, and contains 2 main cell types. Digestive enzymes are produced by exocrine cells and are released into ducts that empty into the small intestine, where they digest carbohydrates, proteins, and fats. The second type of pancreatic cell is an endocrine cell, and these cells release insulin and glucagon into the bloodstream to regulate blood sugar levels and energy production. Cancer results when mutated cells grow out of control, forming tumors that disrupt the normal functioning of the pancreas. There are different types of pancreatic cancer. Endocrine tumors, also called islet cell tumors, are rare. Approximately 1/3 of these tumors are benign, yet they do release hormones which cause some really strange symptoms. The remaining 2/3 of endocrine tumors, also called non-functioning tumors, do not cause symptoms, nor do they release hormones. Most pancreatic cancers develop in the ducts that line the pancreas. Exocrine tumors are called adenosarcomas and comprise 80% of all pancreatic cancers. Endocrine tumors that form in the insulin-producing cells, or the islets of Langerhans, are not as common as exocrine tumors. Cancer can develop in the head, body, or tail of the pancreas, with up to 70% of pancreatic cancers originating in the head, which is the widest part of the pancreas. Fortunately, symptoms such as jaundice generally appear earlier in this type of cancer due to the cancer's proximity to the bile ducts, and this leads to an earlier diagnosis and a more favorable prognosis. If tumors are found early enough, they can be removed before they have spread outside of the pancreas. What are the risk factors for pancreatic cancer? Over the age of 45 is a risk factor. Gender, more men develop the disease. Ethnicity, African Americans and Jewish people are at higher risk. Smoking increases your risk. Alcohol consumption, obesity, being sedentary, and having pancreatic cysts, which increases cancer risk, but it's low, and chronic pancreatitis, and also a diet high in processed or smoked meat. Risk is slightly higher if you've had a first-degree relative who's had pancreatic cancer. Long-term type 2 diabetes is also implicated in developing the disease. Diagnostic tools. Pancreatic tumors are hard to detect because of the location of the pancreas. A variety of diagnostic tools are used, including blood tests, genetic testing, physical exams, biopsies, ultrasounds, CT and PET scans, endoscopy and laparoscopy, and MRIs. There are different surgery options for pancreatic cancer, and which will depend on the location, type, and stage of the cancer. Conventional treatments, including surgery, chemotherapy, radiation, and targeted therapy, which is a type of therapy that blocks cancer cell growth by interfering with target molecules that promote tumor growth. Various surgical procedures are used in the treatment of pancreatic cancer. One is called the Whipple procedure, and this is where they remove the gallbladder, the head of the pancreas, and portions of the common bile duct, stomach, and small intestine. But it doesn't negatively impact digestion. Another surgical option that may be necessary is removing the entire pancreas along with the common bile duct, spleen, gallbladder, surrounding lymph nodes, and sections of the small intestine and stomach. A distal pancreatectomy involves removing the tail and body of the pancreas along with the spleen. And here are some of the symptoms of pancreatic cancer. High blood sugar, which in itself does not indicate pancreatic cancer, but it may be worrisome if it's accompanied by other warning signs such as exhaustion, abdominal pain, and weight loss. People with pancreatic cancer may develop diabetes due to the pancreas's inability to produce insulin, and this results in high blood sugar. Diabetes is epidemic in the U.S., but most people with the disease do not have pancreatic cancer. Abdominal pain. This is a very common symptom of pancreatic cancer, with over 70% of patients experiencing symptoms. And this includes mild cramping, a dull chronic ache in the abdomen, and even more severe pain that radiates around to the back. Pain is often accentuated by lying down or sitting. Discomfort is intermittent in the early stages, but increases in intensity as the disease progresses. Exhaustion. Exhaustion, fatigue, and lack of energy are due to the body's inability to break down food into available nutrition and also to balance blood sugar levels, which will make you tired. Fatigue can also be the result of chronic pain caused by the cancer or as a side effect of conventional cancer treatments. Jaundice. This is a very common symptom of pancreatic cancer, and it occurs from an accumulation of bilirubin, which is a byproduct of the breakdown of red blood cells, and it gives the skin and the whites of the eyes a yellow cast, and it's one of the first signs of pancreatic cancer. Bilirubin is a component of bile and is released through the common bile duct to break down fats in the small intestine. In pancreatic cancer, however, the bile duct becomes blocked, and this leads to a buildup of bilirubin. Dark-colored urine and light-colored stools, or greasy stools, are other signs of jaundice. Other conditions, such as hepatitis, gallstones, and diseases of the bile duct, can also cause bilirubin to build up, as can pancreatic cancer that has spread to the liver. Weight loss is another symptom of pancreatic cancer. And this is a result of the digestive system's inability to produce the enzymes that break down food. Fat digestion is especially compromised, and this leads to bloating, abdominal swelling, a feeling of fullness, and or a loss of appetite. Blood clots. People with pancreatic cancer may develop blood clots as a result of malignant cells reducing the proteins that prevent clotting. But blood clots may also occur after any kind of trauma, such as a car accident or a sporting accident, or following surgery, or also laying stationary for long periods of time. Clots, however, that develop in the absence of these situations are a potential warning sign of pancreatic cancer. Alternative therapies can be used in conjunction with conventional therapies to fortify and strengthen the body. Steve Jobs, who died of pancreatic cancer, at one point treated his cancer holistically. He made tremendous progress until he went back to work and was exposed to inordinate amounts of EMFs, which are known to negatively impact detox pathways. There are many complementary cancer treatments that have been successful in improving immune function and aiding in detoxification. Among these are ozone, immunotherapy, high-dose enzyme therapy, nutritional therapies, pulsed electromagnetic therapy or PEMF, hyperbaric oxygen, DMSO potentiation therapy, infrared saunas, rife, cannabis, Laetrile, insulin potentiation therapy, Eziac T, and low-dose naltrexone. In summary, over 50,000 people in the United States will be diagnosed with cancer of the pancreas, with an increase anticipated in 2019. 3% of all cancers are pancreatic, accounting for 7% of all cancer deaths. The lifetime risk of getting pancreatic cancer is approximately 1 in 64 people, but this doesn't take into consideration potential risk factors. Pancreatic cancer is aggressive, and it's painless until it has spread outside of the pancreas. This makes it hard to diagnose in the early stages because symptoms aren't apparent until the disease is more advanced. Do you know someone with pancreatic cancer? Please leave your comments below. Thanks for watching.